You're watching the Randy Alvarez Business Report. I'm Randy Alvarez. Today's topic, how to increase the dental implant part of your practice. With us, we have board-certified oral surgeon. He lectures all over the country, all over the world, Dr. Anthony Sclar. Dr. Sclar, welcome to the program.
Oh, thank you. Thank you for the opportunity. Yes, we have a fantastic training center in Miami, Florida with the top technology.
Now, you offer 4 courses, is that correct?
Yes, we offer 4 courses, and the goal of these courses are to give the doctors additional skills. They gain skills in treatment planning and in procedural skills. The first course I want to talk about is the full arch immediate function. That is a course that we've had tremendous success with.
You call these immersion courses.
Yes, they're immersed in one topic. That course is 3 days, so they have at least 24 hours of education, including hands-on, live surgery. Many times their assistants can come with them to help them implement, and that helps round out the whole educational process.
Any fun at these meetings?
Yeah, we have fun. We have a lot of fun.
You're like a dynamo speaker, by the way.
No, we have a lot of fun in these courses because my purpose in opening this training center is kind of the purpose of my life. In other words, to help other people.
Okay.
And so when I help these docs, think of all the patients they help. So in the immediate function course, full arch, we've had doctors within a month that have sent us emails with pictures and saying they've already done all these cases.
One of my clients, how I heard about you, Dr. Mulzan, said you completely changed his practice. He went to one of your immersion courses.
Yes, yeah, and it makes us really happy.
I mean, their first month after going to your course, it was like over $80,000.
Yes, absolutely.
Is that common? Is that typical what you hear?
Well, we have doctors that tell us within 12 months they've done over $1 million of surgery out of the courses that we have had them take. So the other course that we take, then we have a series. This was put together how I would have loved to learn it. When I started learning, these courses didn't exist. So these are the dream courses that could have shortened my learning curve. One is soft tissue periodontal and peri-implant plastic surgery.
When they're done with that first course, what are they ready to do back in their practice?
That teaches them how to manage all the soft tissues, how to do soft tissue grafting, and that's sort of the building block to then do the second course. The second course is advanced bone grafting and tissue engineering. And once they know the soft tissue, they're going to have better success with the bone grafting. And we really strongly suggest they follow the series. And then after they've mastered the bone grafting, they go on to the most challenging area that's expert level. They can become expert level or master level with the aesthetic implant therapy course. And these courses are what we call interdisciplinary. If they're a surgeon, they still learn about the restorative.
Okay.
And we have different faculty that teach with us. And we have a great team that all have experience that help train their assistants.
Is this a combination of specialists and general dentists that are attending these?
Yes, we get advanced practicing general dentists, and we have some phenomenal ones, that come in. And then we have specialists, periodontists, oral surgeons, prosthodontists. So we get all of those in our courses.
Each one of these, by the way, are all based on this model of 3-day immersion?
Yeah, we have the 3-day is the immediate function. The other ones are 4 days. And we offer that we stay connected. They send us their successes. When they have a failure or they have a complication, they know they can call me. Or they can call Dake, the director, and he will have me then talk to them. We also provide video education for them for 6 months after each course. So it's very comprehensive. We don't hide anything. It's true teaching. We're not influenced by any corporation. We think we're doing a lot of good out there.
What is that 4th course? And I'm sorry I was interrupting a little bit here.
The 4th course is the aesthetic implant therapy. So we go over the surgical and the restorative protocols to get beautiful teeth. And that's really the most challenging area.
There are a lot of other guys that have courses teaching similar topics, right? How do you see yourself as different or better?
Okay.
Or are you better?
Well, I think we're doing an incredible job. The feedback from our students And the number one thing is that we give all the details. We don't hide anything. I have zero ego when I'm teaching these doctors. In fact, in every course, I tell the doctors in the beginning that I'm expecting to learn something from them. I tell them on these topics, I'm going to be ahead of you, I think, you know. But so we teach them all the evidence-based scientific stuff, which a lot of courses skip.
Okay.
But then it makes them better clinicians. And so we have a small group, only 16 doctors. Sometimes we have their assistants, and it's a very intimate setting. There's a lot of information exchange between the students and between the faculty. It's not just me. We have prosthodontists on faculty, advanced trained dentists on faculty. So, and we also have some information that we transfer from my team. My treatment coordinator has been at this for over 20 years. I have a phenomenal administrator that has a lot of clinical experience. All my team members, assistants, they know these procedures inside and out. So we do live surgery. We have these robotically controlled HD cameras. They can see multiple views, and they can talk to me while I'm doing the surgery. We don't pick simple cases. We already have the reputation, because a lot of the work we do is in the training center is pro bono. So if the next person on the list was a hard case, we're happy. I want them to see me struggle, because they learn and they see that we finished a case. And then we have a high-tech lab where they do hands-on. All our hands-on training is guided. Every procedure they learn, they do on a model, on a cadaver specimen, and it's all guided by videos. They don't have to look at a workbook. And then we have treatment planning. That is the most important. We put up cases. It's no pressure, because the group becomes bonded. They actually call each other after the courses, and I say, no pressure, guys. How would you treat this? And you know, they do their best, and I'll say, okay, this is how we treat it. It's a little different, but you know what? Your idea was good. So, because in order to have success, you have, when a patient, you're examining them, you have to know what you can do for them, and you have to tell them. Otherwise, you get no case acceptance. You know, they're sitting there like waiting, like, well, if he doesn't say anything, it's because he doesn't know, or she, you know. So I think the other thing is we stay in contact with our alumni. So we give them videos that they can watch on a library for each course for 6 months. They can call us if they have an issue. They share their successes with us. And then beyond that, we have course for alumni. You know, we're in our 7th year, and now we have enough alumni that we could do just kind of a course for them. And it's like an ultimate master's course, because now they're going to come back and get refreshed on all the topics.
Now,
What's
for
new?
people that stumble onto this video, tell me about your practical experience and how long you've been around dental implants. And for people that don't know, you lecture like half the year on this topic.
Yes.
So tell me about your background.
You know,
let's have you brag about yourself for a second.
Okay.
Right?
My background, I did my oral and maxillofacial training in University of Miami, Jackson Memorial Hospital. I also did an anesthesia fellowship in general anesthesia. I've had some general surgery training as well as some plastic surgery training. So I started in private practice in 1989, and most of what I did was corrective jaw surgery. That was the biggest part of my practice. I loved it. And for a number of years we did that. And even when the insurance industry changed that, I had a big practice of fee-for-service, people traveling in. But then I also had the good fortune to know something about implants. Because even in dental school, when everyone said they were bad, and in oral surgery training, I was told that they were bad, never do them, I was looking at the science. I actually got my initial training under Dr. Brandemark, who's just passed away. His right-hand person was Ulf Leckholm. And I did the original training with him. And I remember I wanted to get the Brandemark system. That was the best. But it was $25,000, and I worked for another doctor. He said, no way, Tony, we're never going to do that. So instead, I got another system for $49.99. The rep came to the parking lot. It was a German system, pretty good, and I got 20 implants for that. And I placed all 20 of those implants on people that had no money, because I just wanted experience. And that's how I started. So I've been involved in implants for a very long time. I got solicited to write a book. It's not that I wanted to write it. I was kind of surprised. I gave a presentation in Chicago in honor of a famous oral surgeon that had passed away, and he had a foundation. And so I went and gave the lecture, and the vice president of Quintessence approached me and said, "Oh my gosh, that's a book." And that was my start. And I'm authoring an update kind of book. But we really loved the teaching because after I published that book, I'm very creative, and there's some other things I like to do in life. And I thought about, maybe this is it for me. And John Coyce, I don't know if you probably know him.
I've heard the name, yeah.
John Coyce and I lectured together, and he pulled me aside and gave me a talk. He says, you're a really good teacher, and you didn't prepare. You were not prepared for this presentation, but you're still a good teacher. He says, think of how it would change your life and other people's life if you focused on this. And he invited me to his training center in Seattle, told me, don't build something so big, build something small.
Dr. Sclar says it's not how good you are, it's how good you want to be.